I rise today in support of Senate Bill 82. For millions of Michiganders and people across the country, the pandemic did not suddenly make their lives harder. It didn't make it suddenly hard, it made it harder. Disruptions like the coronavirus hit some communities harder than others. I support this budget because it addresses these inequities head on while making healthcare better for everyone. While some of us enjoyed the safety of working from home, direct care workers in our mental health agencies, in our nursing facilities, in our area agencies on aging, and adult foster care risked their lives to save others. They deserved raises prior to the pandemic, and they certainly deserve a raise for all that they have done for us and for all that they have sacrificed during this time. This budget offers a wage increase for these direct care workers, for these frontline heroes. These professionals put their lives on the line to save the rest of us. They deserve a fair wage for shouldering the weight of our world, and this bill gives them the raise that they deserve. This pandemic didn't affect all communities equally. It ravaged our Black and brown communities. And this bill helps our communities. We cannot sit idly by and watch as Black and brown communities are devastated again. We can't allow these disparities to continue. We must do better, and we can. This budget will help address the profound health disparities that threaten Michiganders' lives. Due to the tenacious work of our colleague from the 54th District and others, this budget will expand Medicaid coverage to include sickle cell disease and offer support to communities of color that they need to be able to stay healthy. As a clinical psychologist, I know firsthand that almost everyone's mental health took a hit during the pandemic. But the pandemic hit those struggling with mental illness and substance abuse problems even harder. This budget supports our certified community behavioral health clinics to increase that access to the mental health treatment and substance abuse services that so many need. Our elderly residents are especially at risk. Grandparents couldn't hug their grandchildren, and this bill supports the Michigan Choice Program, which offers seniors whatever health care treatment that makes most sense for them, whether it's assisted living, counseling, or help around their home. And Black women, we are three times more likely to die from pregnancy-related complications than white women. This budget offers funding to Healthy Moms, Healthy Babies initiatives, which expands prenatal care and ensures the safety of mothers for 1 year after birth, and to help them address the challenges of new motherhood. This budget offers implicit bias training for doctors to help them reduce the fatal racism that occurs in our healthcare system. And at a most basic level, this budget includes lead poisoning prevention to ensure that we have access to safe drinking water. These inequities have existed for far too long, and this bill confronts them head on. Now is not the time to debate state vaccine mandates. Let's save the discussion for whether we should listen to our scientists or conspiracy theorists for another day. These disparities are too important to not address right now, right here. They cannot wait, and this budget cannot wait. I encourage you to join me in showing that the health of Michiganders is a top priority by voting yes on this budget. Thank you, Madam Speaker.